What tests diagnose female infertility causes? When trying to understand why conception isn't happening, doctors use a series of tests to find the root cause. These tests are designed to be as gentle as possible first, then more detailed if needed. They help identify issues like ovulation problems, structural abnormalities, or hormonal imbalances that could be affecting fertility. The process begins with a detailed medical history and physical exam. The doctor asks about menstrual cycles, past surgeries, and symptoms like irregular periods or signs of hormonal imbalance such as excessive hair growth or acne. They also check for any physical signs of pelvic issues, including endometriosis, which can cause pain or other symptoms. Next, ovulation testing is key. Blood tests measure hormone levels like progesterone, which rises after ovulation, to confirm if ovulation is happening regularly. If cycles are irregular or absent, additional hormone tests may be ordered, including follicle-stimulating hormone and estradiol. Urinary tests that detect luteinizing hormone can also help predict when ovulation occurs, providing insight into whether the ovaries are releasing eggs normally. Ovarian reserve testing is another important step, especially for women over 35 or those with a family history of early menopause. Blood tests for anti-Mullerian hormone give an estimate of remaining egg supply. An ultrasound called an antral follicle count counts small follicles in the ovaries, offering another way to gauge ovarian health. Thyroid function tests are routinely done because thyroid disorders can interfere with ovulation. Elevated or low thyroid hormone levels can disrupt regular cycles. Prolactin levels are also checked since high prolactin can prevent ovulation from occurring normally. Imaging studies help visualize the reproductive organs. A transvaginal ultrasound provides images of the uterus and ovaries, revealing fibroids, polyps, or ovarian cysts. For assessing the fallopian tubes and uterine shape, a hysterosalpingography involves injecting dye into the uterus and taking X-rays to see if the tubes are open and the cavity is normal. Saline infusion sonography is similar but uses saline and ultrasound to better detect polyps or fibroids inside the uterus. In some cases, doctors may recommend minimally invasive surgery like laparoscopy. This allows direct visualization of the outside of the reproductive organs and is especially useful for diagnosing endometriosis. Hysteroscopy, which looks inside the uterine cavity, can identify structural problems like scar tissue or polyps. It's also important to evaluate the male partner. A semen analysis checks sperm count, motility, and shape, helping to rule out male factors that could contribute to infertility. Certain tests are not routinely recommended unless specific issues are suspected. These include postcoital testing, immunologic tests, or advanced sperm function tests. The timing of these evaluations depends on individual circumstances. Women who haven't conceived after a year of unprotected sex should be evaluated, but women over 35 or those with known issues may need earlier testing. Remember, each case is unique, and these tests are tools to help doctors develop a personalized plan. If you're concerned about fertility, it's always best to consult a healthcare professional who can guide you through the appropriate testing based on your health history and circumstances.